Hello people, in this video we want to look at this topic, MicroAlbuminUria. So basically earlier they were using this terminology MicroAlbuminUria, okay, but now they are not using this terminology. Now they are using this terminology moderately elevated albuminuria. So in the exam they can ask you either this or this. You have to write the same thing. What will you write? MicroAlbuminuria or moderately elevated albuminuria. That is, there is albumin in the urine. Okay, this is a type of proteinuria, that is in the urine there will be protein, okay, but this is so less. And which type of protein? Albumin, okay. So because there are a lot of other proteins, albumin, globulin, you know all that. So basically in a healthy individual, in a healthy person, there is virtually no excretion of albumin, okay, because this is because of charge, not because of the size, okay. This charge, positive, negative charge, because of that there is no loss of protein in you and me, okay. But in some people, what is happening, slight moderate amounts of albuminuria has started, let us say in a diabetic person, etc. So these people like diabetics, you should screen them, you should screen a diabetic for microalbuminuria. You cannot detect it in dipstick, okay, dipstick you cannot, but you can detect this protein in other ways, right, chemical methods. So basically for these people, what is the treatment? If you are having microalbuminuria, you should be taking antihypertensive drugs, especially this inhibitors of the renin angiotensin aldosterone system. You should be taking those drugs so that your blood pressure won't increase, because you are going to lose albumin, so you are going to have edema, you're going to have fluid retention, so blood volume will increase, you will have hypertension. So that is why they are trying to give you the inhibitor of renin angiotensin aldosterone system, so that your kidney will help in losing water, right? Renin angiotensin aldosterone will try to increase the blood pressure. So you will inhibit this. So you will try to decrease the blood pressure. That's all they are saying. Okay. These people are more prone to cardiovascular mortality. People who have moderately increased albuminuria. If somebody asks you about microalbuminuria in the exam, you have to write these many points. Okay. If somebody asks you which are the drugs which are inhibiting this renin angiotensin system and all, you can talk about this. Direct renin inhibitors, you have aliskiren, okay, aliskiren. Then you have angiotensin converting enzyme inhibitor, that is ACE inhibitor, that is enalapril, ramipril, etc. Right? You have heard of enalapril and ramipril. Then coming to angiotensin receptor blockers, you have losartan and telmisartan. So renin, angiotensin, what else is there? Aldosterone. Aldosterone means you'll have to write these at the bottom. That is, let me show you. Aldosterone antagonists, you can give spironolactone. Okay. So you have all these four things that are coming here. Direct renin inhibitors, aliskiren, angiotensin converting enzyme inhibitor, ramipril, enalapril, angiotensin receptor blocker, losartan, telmisartan, aldosterone antagonist, spironolactone. So all this are going to inhibit the renin angiotensin aldosterone system, isn't it? The full name should be renin angiotensin aldosterone system, right? That's it for now, guys. See you in the next video. Bye bye.